head 45 degrees to the left, and the important thing is that you do each movement fairly quickly, alright? Have a sick ball around, especially with someone who's got that, okay? And now, Jamie, I'm just going to hold your head, and I'm going to take you back pretty smartly there. Keep going, keep going, keep going, keep going, that's it, to there. Alright, now to incline past the horizontal. Okay, so I've maintained the angle at 45 degrees. We've gone past the horizontal about 30 degrees. Okay. At this point, you get them to keep their eyes open. Okay, and keep your eye on. I usually tell them to watch my nose or watch my forehead, and they'll have really quite bad nystagmus at this stage. And it seems to me the worse the nystagmus, the worse the feeling of dizziness at this point, the more effective it's like to be. Okay. So read out the next.
Next, in the reclined position, the head is turned to the right.
So 90 degrees to the right. Okay. So we're still on there. So we're 45. You okay, Jimmy? Yeah. So we're now 45 degrees to the right, and you hold. You hold every position for 30 seconds. Okay. And then you get them to turn on the right side, don't you? Right. Can you turn onto your right side now, Jimmy? Turn onto your right side, so that your shoulders are vertical. And I'm holding his head still there, and now we'll give that 30 seconds there, and then the next one is to turn his head to the right further, isn't it? Yeah. So we're going to turn his head that way and incline it there, and we'll keep that for 30 seconds, okay? And then you get him to sit at the side of the couch.
Still over there.
I'm going to hold your head exactly like this, Jimmy, but I want you to put you sit at the side of the couch that way. So we're still, and then up you get, that's fine, still holding your head there, hold that for 30 seconds, alright, and then you rotate the head to the midline and flex it, is that right? Yeah, see I've done my homework. So we'll hold it 30 seconds, and then we're rotating your head to the midline and flexing your head like that. And that's it, that's the whole manoeuvre. You do it 3 times, with each treatment schedule, and you can give them a bit of homework to do. I'll show you the homework you can give them as well. There are some exercises, I can't remember, it's Cawthorne Cooksey exercises, have you heard of them? That they're exercises that people do who've got dizziness. And the idea is, yeah, I'll show you the ones that you've just posted. I didn't find them terribly effective. The idea is that you re-educate the brain into taking over the function of the damaged vestibule. Okay, so should we do that again? Yeah? Or do you want to volunteer and Jamie can watch?
Yeah, that's fine.
Okay, you want to? You're not dizzy or anything? No. Okay. So as I said, the secret is just sit on the couch, and you've got to get the patient far enough up the couch so that their head will go over. Okay, so just no, you need a bit more, I think. Just a tiny bit more. That's it. So sit up straight. So let's imagine that the idea is looking to the left. When you look to the left, you get dizzy. So we'll leave you there for 30 seconds, alright? And then we'll bring you right back fairly smartly. Don't worry about your head falling off. And then let it follow behind, past the horizontal. Okay, so at this point, you normally get really quite a bad nystagmus. And that's called, what I've just done is called the Hall Pike manoeuvre, okay? And I think this technique is called Epley Hall Pike manoeuvre. So we'll give you 30 seconds there, and then 30 seconds we'll turn you round there to that side for 30 seconds. Feeling alright? No problems? Did you get to know? If you felt dizzy like this, it would be really horrible. It was horrible. It's absolutely horrible having it done, but it's extremely effective. And always keep a sick ball in there. I'll do it with a wet soap.
At least you're out of the line of fire.
Yeah, that's true. Get a nurse to help you. Right, now can you turn onto your right side? So I'm going to hold your, let your head still come this side. That's it. So we'll give that 30 seconds again, that change. And now we're going to turn your head round, and that's it. And we'll do 30 seconds there as well. And now if I can ask you to sit up on this side of the couch, keep your head in this position, up to there, that's it, and keep there for 30 seconds. And then after that 30 seconds, you want to just turn your head back to the midline and flex it forward 45 degrees.
So, Brian, you always do it 3 times, do you?
Yeah, you do it 3 times for every sort of treatment.
Yeah.
Every treatment period, if you like.
And it's a one-off treatment. You just see the patient once.
That's great, lovely. It's so effective that the only time I failed, it was an acoustic neuroma.
Okay.
So I think that's really effective. In fact, I was at a lecture about 6 months ago by an ENT bloke from Burton who again said you recommended this treatment, and they quote 80 to 85% success rate. Now, what you do for homework is you get them to sit on a couch or a bed or something. Look that way, 45 degrees to the right, and then they fall to the left. Okay, and that's actually made me slightly dizzy. And they hold that for 30 seconds. Okay, and then they do that. They look to the left, and then they fall to the right like that. And they hold that for 30 seconds, and they do that about 10 times a day. There was one. There was a series of exercises. I think they're called Cooks and Crothy exercises, where I sat in them, and I had to look up, down, sideways, look up, down, and move my head around it. It made me feel absolutely terrible, and I did it about 10 times, and it didn't seem to help me very much, and it made me. So I just stopped, and there we are.
So if someone's tried